The views expressed on this special broadcast of the Take 12 radio show do not necessarily reflect those of KHLT Recovery Broadcasting or its affiliates. KHLT is not affiliated with any particular 12-step fellowship.
A very scary experience.
You know, God is a solution. God, the 12 step.
I like where he's going here.
Helps the community grow, helps us grow. Monty has done a phenomenal job.
Lack of open-mindedness. And you're talking about taking people through a spiritual process and getting them into recovery.
Thanks, Monty, and thanks for all your support.
We need spirituality to make this thing work long term.
It's an absolute pleasure. He certainly knows a lot of people.
This is one of the places that is about the business of the solution.
And now, broadcasting on location somewhere in the vast expanse of the Pacific Northwest, it's the over-opinionated 12-stepologist, the Monty Man.
Thank you, Nathan Adams. Nathan Adams is the voice you hear on those introductions when we broadcast on location somewhere in the Pacific Northwest. I, of course, am your host of the Monty Man for this special broadcast of the Take 12 Recovery Radio Show up here in the sober Portland area. I don't know how sober Portland is, but we do want to make sure that we recognize Freedom Interventions and SoberPortland.com. Their websites, they help to sponsor all of our shows. And with me right now is Tom Maisel. Now, I'm going to talk to Tom in just a minute, but the event we are currently at is the Behavioral Health Networking event and luncheon at the Chart House in Portland. This is an incredibly beautiful location overlooking downtown Portland and the mountains of northern Oregon and the Pacific Northwest. It's just absolutely gorgeous up here. Tom Maisel is with the Pasadena Villa Network of Psychology Services. Is that correct? Did I get it right?
Psychiatric services.
Psychiatric services. Okay, sorry. And that's out of Orlando, Florida. But you don't live in Orlando, do you?
No, I live in Chicago. But I travel from New York all the way to L.A. and kind of everything in between.
Right. Well, you're getting around. So tell us what your organization does and what you do specifically with this organization.
Sure. I'd be happy to, Monty. First of all, it's great to be here, and thanks for having me on the show. What we do is that Pasadena Villa is a program that's designed specifically to help individuals with a primary psychiatric diagnosis. So if we're talking bipolar disorder, severe anxiety disorder, schizophrenia, schizoaffective disorder, and even Asperger's. And primarily what we do is that not only from a clinical perspective, but it's an opportunity to help individuals to self-regulate, to help navigate, to understand their social integration skills, life skills, to help them prepare for life as it goes on. And it's an opportunity for them to fully understand their disease and to how to manage their lives.
Do you find that the clients that your organization has worked with, that there is their fair share of people that perhaps are from the faith community that have really struggled with the whole idea of moral issue versus illness?
No, not necessarily. What we're finding is that individuals who have had issues starting sometimes as a child, a lot of adoption issues, abandonment issues, that have developed into other areas in their life, some chemical dependency, which we'll treat secondary, and they medicate themselves really to help self-regulate. So we're finding that whether it's their religion or faith is not really doesn't play a role. It's really how are they managing their lives and how does it affect the nuclear family and how to be productive.
And in your experience, well, how many years have you been doing this?
Going on 20 years.
Okay, 20 years. So you've seen a lot of people come and go. Can it be heartbreaking?
Very much so, and at the same time can be very rewarding. I never forget the story in which that I got a call from a mother of a 22-year-old male that we had in treatment, and she was in tears on the phone, and I'm thinking, oh my gosh, what happened now? And it turns out while in treatment they went to dinner, and she called and said, just want to let you know, this is the first time we've had dinner, and my son never acted out. He behaved. His disease seems to be under control with the medication, and he was appropriate, and I've never seen my son like this before, so it was extremely rewarding for her.
Okay, so take us through the average, the process. Somebody knocks on your door, okay, and they say help. What happens from day one?
Sure, and I usually have them call me before they call admissions. I think this is an opportunity to engage, and typically I'll get a phone call from a family that has been through other experiences, treatment experiences, and they're really looking for something that a little bit longer term, and we're a longer term facility, at least 90 days, for an opportunity to work with an individual. So they call me, and I do a little bit of a history to find out really what has happened recently that made them pick up the phone to call me. There's usually some type of crisis or something that has happened. And so I have an opportunity, I'm also a clinician, and an opportunity to assess the situation and determine clinically are they appropriate, and then what we need to do. And so I start engaging them, and then when the next step would be, and if they're ready to take the next step, would be to talk to our admissions and intake department. But we want to take a look at what some of the treatment goals and objectives would be. We're not a program where someone would just stay there and house. The idea is to help them lead a productive life. We get a lot of young adults, a lot from college, that may decompensate and have, in the past, it would call a nervous breakdown, so to speak, and help them manage that and then get right back to school again.
We do a lot of talking on the show about the allergy of the body and the obsession of the mind, which we know isn't always the case with the heavy drinker or alcohol or drug abuser. They just need to grow up. They just need some basic life skills, and they're on their way. Do you find that that's pretty easy to diagnose which one's which? I mean, who's really the real deal and who just needs to get a life?
Well, since we do work with chemical dependency as a secondary diagnosis, and we can divide that into two areas, one psychiatric and one addiction. With addiction, yes, through a history, we really try to get an idea of what's been going on, as we know this is a disease. And typically they've been through other programs, and we manage the quality of life and the consequences and all those things that happen and their age. I mean, if we're talking someone who's 38, 40 years old, and they're still acting like this, there's probably many issues going on, including addiction, but there has to be obviously assessment and evaluation to determine that. When it comes to mental health, it usually starts at an earlier age. Young adults or late teens, we start to see behaviors like that, and again, by the time they call me, they've been through multiple treatment experiences and it hasn't worked for them, and they're missing a component. So that's when we really have to do even more stronger assessment evaluation and determine if medication and behavior therapy is appropriate.
Okay, so you said a key phrase. It hasn't worked for them, and we have quite a few listeners who are friends and family of. Some of them just don't get it. Some of them don't want to get it. Some of them do and are confused. Some of them are trying real hard, and they're like, why didn't it work? This is the third time through. He did 30 days. He did the 90 days. He did the year. He was in Teen Challenge for 2 years. He was at Origins for 9 months. Why isn't this taken? What has been your experience?
My experience, really, Monty, is that we have found that many individuals who continuously relapse and have issues, that there's a lot of trauma and perhaps even a secondary psychiatric diagnosis that really hasn't been addressed to the level in which that it provides them from insight to be able to grow from there. And so when I get these phone calls, they've been through 3 or 4 treatment programs, but when I ask about the trauma, we haven't really dealt with it. Well, that keeps surfacing, and that's what's causing them, for many individuals, I'm not saying it's across the board, but for many individuals, it's an opportunity that they have then to relapse. And same with from a psychiatric perspective, they may have an undiagnosed psychiatric diagnosis that, so they're medicating themselves and continuously to use. They go to treatment, that underlying psychiatric diagnosis hasn't been identified, and then they start using again because they need to medicate themselves.
Right. And we're hearing, I think, a lot more of that word trauma than we have in the past.
Yes.
And I say this a lot, and people probably get tired of me saying this, but I think it bears repeating a lot, is that we're finding that at one time, not too long ago, we were making statements like, we think that there is a large percentage of people who have experienced trauma that are actual addicts and alcoholics. Now we're saying in every case.
I would say that's pretty close to that.
Pretty close, yeah.
Yeah, and what's interesting about trauma is that it's not necessarily the trauma, but how we perceive or react to the trauma. Because you could have someone that was not hugged enough, and someone was hugged too much. Well, why does one person react that way? There's many factors that play a role. So how do we perceive or react to a particular incident that causes that trauma? And that needs to be dealt with. We've seen many individuals who have, when we look at shock trauma, come back from the war, with PTSD. Some do exceptionally well, but why is someone else not doing it in the same situation? It's so individualized, and it takes a very acute and an astute clinician to be able to identify that.
So I'm walking up the hill at a men's retreat one year, and I have back issues. And I'm like, I'm just dying, man. I'm just telling my buddy, I said, Jeff, man, I just can't make it up this hill. My back is killing me. And what he says to me, he says, you don't even know what pain is. I fell off of an overpass. And it dawned on me that one man's pain, right, severe pain to somebody else. I mean, I can't even imagine the pain that this guy's gone through. But for me, my pain was very real. Okay, so trauma is the same thing, right? You said it. Somebody was maybe not hugged enough, and we think, oh, what's the big deal there? But for that person, that was major.
That's exactly right, and it's very subjective. And so there's many factors that play a role in how you perceive trauma, how you're raised, and experiences in your life, and it's just a multiplicity of factors that play a role. But that's a very good point about the pain that you have compared to someone else's.
Right. And so, we've heard statements for a long time now within our 12-step fellowships. Well, you're not an alcoholic or an addict because your mother raised you on the toilet backwards. And we get a chuckle out of that, but maybe there's something to that.
I think there is, and when you have an opportunity to work with a family and you first meet the resident and then you meet the family members, and sometimes the apple doesn't fall far from the tree, and so that's why this is also a family disease, and any type of therapy requires the whole family to be part of it. We won't accept any client that comes to us without the family involvement, the parents' involvement, the significant other. You just can't drop someone off and say fix them and send them back, because they're going back into an environment that was toxic to begin with. To that individual, perhaps toxic. And so this is an opportunity now to really work as a family unit.
Yeah, and people that are listening right now that are family members and friends of, you need to get that. Okay, why should you have to go to a meeting or go to a seminar or go to a symposium or learn anything? He's the horse's patoot, right?
Yes.
Well, I'm sorry, but sometimes you guys are going to have to work even harder than the addict or alcoholic.
I agree with you 100%, and I always use the tin can analogy. I say, let's say your son is this rusted tin can, you send him to us, we get him nice and shiny, and if we put him back in the same environment, he's going to get rusty again, so something in the environment needs to change. So we need you to come on in, and we want to work with you, and I think parents and family members understand that, because there's really no blame there. It's more of an educational process, and then we help them to create an environment that's much more conducive to recovery, but also to help themselves too.
Yeah, excellent. Well, Tom, thank you so much. And you and three others are really responsible for putting on this event here at the Chart House. Where are you going after this?
I'm going back to Chicago for the weekend, and then I've got to fly to Miami, where I've got meetings all set up for the whole week there. So I'm always on the road. I'm always working with families. Individuals can always call me. I'd be happy to give out a phone number. It's open to everybody. It's area code 312-550-6547. That's my cell phone. It's 312-550-6547. and I'll be happy to talk to anybody, and if we're not the right program, I'll be happy to find a program that is appropriate for them.
And that's great. What's great about networking is we can help people plug into where they need to be plugged into.
That's the whole purpose. It's not necessarily trying to find for us, it's trying to help the family, and the reason I love this job so much is because I go to bed every night knowing I've made a difference, and that's my goal.
Yeah, all right. Tom Mazel, did I pronounce it right? Mazel, yes. And I'm so glad that you're here. Thank you for helping to put this on. And say the name of the organization again. Make sure I don't get it wrong. You tell us.
The easiest is just Pasadena Villa. And it's
Pasadena Villa.
PasadenaVilla.com, correct.
Okay, and we'll have the phone number and the website up on our YouTube page when people are watching. Thanks, Tom.
Thanks, Monty. Really appreciate it.
Okay. All right. We'll be right back after this. Hey, September is National Recovery Month, and the Recovery Northwest Project, September 12th through the 14th. Beginning Friday at 9 a.m. with an incredible 2-day conference at the Red Lion, Vancouver, featuring the movers and shakers of the recovery community. Then on Sunday, we'll move on over to beautiful Esther Park after the recovery walk and to join the powerful Hands Across the Bridge ceremony. Exhibitors, music, speakers, fun, food, and the power in numbers as hundreds of us gather to celebrate National Recovery Month at the Recovery Northwest Project, Vancouver, Washington. Visit recoverynw.org for details on all the events. Supported in part by the Clark County Department of Community Services Alcohol and Drug Program and the Clark County Substance Abuse Advisory Board.
Treatment does not have to be voluntary to be effective. Sanctions and enticements from family, employment settings, and or the criminal justice system can significantly increase treatment entry, retention rates, and the ultimate success of drug treatment interventions. Freedom Interventions provides the direction necessary to get the help of an addiction intervention. We assist with selecting a treatment experience appropriate for the unique needs of your addicted loved one and provide 6 months of ongoing support to ensure success for everyone involved in the transition into real life. If you know someone who needs a life-saving intervention, visit freedominterventions.com or call 888-762-7557. That's 888-762-7557. Freedom Interventions, providing drug and alcohol interventions and a continuum of care services to clients and their families.
My baby boy was a very good sleeper. He would nap in the morning and nap again in the afternoon, so my routine became that I would drink the first half of the time I expected him to sleep so that I could pass out the second half. Even during my pregnancy, knowing that it might be harmful to the baby, I could not stop drinking. The fear of any harm to that child was not enough to make me stop. Sometimes I would try to go to the park with him, but I was becoming really fearful of people finding out what a sick person I was. Today, since I joined AA, I don't have that sensation anymore at all. I have a purpose in life today. I know who I am. I know where I'm going, and I feel good about it. I can be a mother to my child, and I can be a wife to my husband, and I couldn't be any of those things when I was drinking. Alcoholics Anonymous. It works. Look us up. Check your phone book, newspaper, or AA.org.
All right, welcome back, everybody, and thank you for tuning in to Take12Radio.com on your internet dial, broadcasting on location at the Chart House in Portland, Oregon. And we are here at the behavioral, what do I want to call it? The Behavioral Sciences Networking event. And this is being sponsored and presented particularly by 4 different people. Tom Mazel was just here with us. Karen Hunt is with me right now, and Karen is the clinical outreach consultant for Psychological Care and Healing Treatment Center. Karen, what is it exactly that a clinical outreach consultant does?
I actually am doing branding and marketing for PCH.
Okay, and so what is branding?
We take the PCH name and we take it all over the United States and we let people know who we are.
Okay, so you're spreading the word about what you guys do. And how long has the Psychological Care and Healing Treatment Center been around?
We've been around for almost 5 years now.
Okay, and what is it specifically that you guys do?
We are a psych residential intensive outpatient program, and we also have an OCD program that we opened about a year ago.
Do you find that folks living with OCD are prime candidates for drug and alcohol abuse?
That's a loaded question.
It sure is, isn't it?
I mean, we have several of our clients that come through our program that do not have drug and alcohol issues. We do ask them to agree if they do not have a problem with it, that they don't use any alcohol or anything while they're in our care.
Right, because that can just hinder the process, right?
Correct, yes. And also make it difficult for the ones that are in treatment that do have those issues, because not only do we treat psych, which they have to have a primary psych to be admitted into our facility, but we can also simultaneously treat drug and alcohol addiction as well as eating disorders while they're in our care.
Let me ask you the same question I asked Tom. Friends and family members of folks that are in your care, do they have work to do too?
Absolutely. And we make that mandatory when the client comes into us, that the families be involved. We have a family weekend. And after that weekend, we can work with the family members through the whole continuum of care with the client patient.
And do you find that sometimes families balk at that and they think, well, he's the one with the problem or she's the one with the problem. Why do I got to work?
Sure, that's common. That's an everyday occurrence that we run into. But we really try to educate the family members how important it is that this is a family disease.
Okay, so your organization, is there one location? You guys have several locations where you house people and work with folks?
We have one location. It's right outside of L.A. It's on Venice Boulevard, and we have actually 2 beautiful homes, and then we do our treatment actually at an office building, and we have one whole floor of that office building, and we just keep growing.
Yeah. So there's room for expansion. You guys have no problem getting bigger and bigger.
We have no problem getting bigger. We've got some things coming down the pike in the near future, but I like to call our facility a boutique facility. We have 24 beds, and we have a staff of master levels individuals, and we have 2 psychiatrists on staff, and it's just it's a great place to work.
How did you get into this field?
Well, I got in the eating disorder field to begin with, and then went into addictions and then into mental health. I actually have a sister that I lost at the age of 18 years old drinking and driving. I have a father that is an alcoholic, and I was married to an alcoholic for several years. So I got into this field because God said I needed to be in it. And it's very passionate for me to be in this field because I work closely with a lot of possible patients and family members, and it's my way of giving back.
So, more than just burdened by it, called to it.
Correct.
Yeah. What'd you say?
Strongly.
Strongly called to it. And as Tom was saying earlier, this can be heartbreaking, true?
Absolutely. It can be heartbreaking.
But very rewarding.
It's rewarding.
Yeah. So, let me ask you a real personal question. What does your family think about what you do?
They feel like God has put me in a place that I need to be, and they're very proud of what I do. That's awesome. So they're real supportive. Okay, this is a issue and a topic I don't dance around at all on this station. We're a faith-based station. We make no apologies for it. We believe that the original 12-step fellowship was. We also believe that things have changed. Not necessarily for the better. I think to get back to our roots, we need to stop dancing around the God issue. What do you think? There again, that's a loaded question. I try not to be judgmental in the way I live my life, and I personally believe in God. I believe in the 12 steps, and I believe the 12 steps has helped millions of people. We are seeing some resistance with that, and I think that we're in a cyclical time right now where people are branching out to try different things, but I think the core values of the 12-step, people will eventually find themselves back to those core values. I think you're right. I really do. So I tell people, even though we're disturbed by some things, let your heart not be troubled because God's still in control. Correct. Yeah, right on. And one more question for you.
with the really the tremendous flow, this is going to be another loaded question, look out. With the tremendous flow of medical-assisted treatment, Suboxone, Vivitrol, we could just go on and on and on. Do you guys, in the work that you do you see that this is something that is helping people with mental illness, alcohol and addiction problems, or do you see it's something we need to be very careful with? What's your view on it?
Well, I believe, that's Pandora's box. And I feel that if we look at mental illness or drug and alcohol addiction, as we look at heart disease, as we look at diabetes, those things can be controlled by health, exercise, diet, and some form of medication. But those are very managed in the people that are having to take those. There's been a lot of research done with that also being used in drug and alcohol addicts and also mental health patients. So I think that there is a need for some medications, but I believe that we need to err on the conservative side with that, and that's not been the best policy in the medical field. Yeah. So I think every person is different. And I think we need to really drill down and individualize how we help our client patients.
So wisdom is probably the key word here. We need to use wisdom.
Wisdom would be good.
Yeah, very good. Hey, listen, Karen, thank you so much for spending some time with me.
Thank you, I appreciate it.
And thank you for helping to launch this event today. That's much appreciated.
Thank you, appreciate it.
All right, stick around for a minute. I got to get a picture, okay? Folks, don't go away. More here at the Chart House on location with Take 12 Radio, recovery talk, and positive music. And when we come back.
Sober Chat App is the first ever location-sensitive mobile chat application designed to instantly connect people who share the common goal of staying sober. Sober Chat will revitalize and revolutionize 12-stepping as we know it. At any time of day or night, you can simply log on and help someone by making phone contact, taking someone to a meeting for coffee, or chat via text messaging on the Sober Chat mobile application. Register now for your download of the Sober Chat app. Visit SoberChatApp.com. That's SoberChatApp.com. The power of sharing is now at your fingertips. Sober Chat, the app that saves lives. Sober Chat is not a replacement for attending 12-step meetings, sponsorship, or working the 12 steps.
Hey, dude.
Hey, bro.
Man, I am so excited about this year's National Recovery Month.
Why, bro?
Because, dude, on September 12th, 13th, and 14th, hundreds of recovery folks will be gathering in Vancouver, Washington in unity and purpose, dude.
Pardon me, bro, but what purpose?
Aw, dude, to celebrate the gift of recovery. Pay attention.
Really? What time, bro?
At 9 a.m. Friday morning, September 12th, an incredible recovery conference will kick off the event at the Red Lion Inn in Vancouver, Washington, dude. Exhibitors, speakers, and presenters will all come together as we break down the stigma of addiction, dude.
Yeah? Then what happens?
On Sunday, we'll walk on over to Esther Park for the powerful Hands Across the Bridge ceremony, dude, followed by Oxfest. You know, the sober living folks.
Can I bring my buddies?
Everyone's invited, dude, and it's free.
It's free?
Dude, what did I just say?
For details on all the events at the Recovery Northwest Project, visit recoverynw.org. Supported in part by the Clark County Department of Community Services, Alcohol and Drug Program, and the Clark County Substance Abuse Advisory Board.
I had this illness that really made me powerless over alcohol, and that insisted that I got drunk. And so I got drunk. It doesn't have anything to do with trying to control it. An alcoholic who picks up the first drink will pick up the second drink. I can't say to anyone, no, don't drink. But I can say that when you decide you don't want to drink, come to AA. The door to AA is always open. Alcoholics Anonymous. It works. Look us up. Check your phone book, newspaper, or AA.org.
Zippity-doo-dah-day. There's only one radio station on the internet that plays recovery music, Christian contemporary, jazz, and rock, and that is Take12Radio.com.
All right, welcome back, listeners, and you are tuned into Take12Radio.com on your internet dial, Recovery Talk and Positive Music. We are here on location at the Chart House in Portland, Oregon, for the Behavioral Health Networking event and luncheon. And Alan Altman, who is with
the Menninger Clinic,
is sitting with me right now. Alan, you are one of the sponsors of this event. Tell us what the Menninger Clinic is. Now, we just heard you talk about it, so I'm going to make you talk again. But the listeners haven't heard yet. So tell us exactly what the Menninger Clinic is and what do you do there?
The Menninger Clinic is a specialty psychiatric hospital. It's been around since 1925. It used to be in Topeka, Kansas, now located in Houston, Texas, since 2003 affiliated with the Baylor College of Medicine. And we're a specialty psychiatric hospital treating adolescents and adults. We're number 5 of America's best hospitals, and this year the U.S. News and World Report, they've been doing that report for 25 years, and we've been in the top 10.
That's quite an accomplishment. Now, this doesn't just deal with drug and alcohol addiction, right?
No, not at all. We are a specialty psychiatric hospital. Unlike many of the treatment centers which do great work around the country, Menninger Clinic does not treat by diagnosis. Our average patient has about 3.5 to 5 co-occurring diagnoses by the time they come to us. They've been in a variety of other settings, so we treat based on what they call the acuity of the patient, how severely impaired the patient is, based on their any chemical use they may have. Many patients don't have chemical use, but also based on psychiatric diagnoses they have. They can have many different things going on at any one moment, and we address those things simultaneously while they're in our care.
Okay, you said a word that several people have said today. You said trauma. Okay, that is really a big deal. We've talked about it today several times on this show. Are you finding the same thing that everybody else seems to be, all your other colleagues are finding, is that trauma is a huge piece when it comes to people being hospitalized or treated for mental illness, for addictions, for any of the things that the Menninger Clinic works with?
Menninger, like many of the other programs, finds that difficulties with attachment, as infants are growing, they learn to attach either securely or insecurely or some combination of those with their caregivers. So for people who grow up in homes where there's chronic illness, themselves and others, people who grow up in homes where there's addictions, another type of chronic illness, people who grow up in homes where parents have schizophrenic or other types of diagnoses, the parents are not able to be there in many cases. They're well-meaning, they provide safety in a lot of cases, but they're not able to be there for an infant to be able to feel secure that their needs will be taken care of. Those are the roots of trauma, things that interrupt that secure attachment feeling that the world is a safe place. So yes, we deal with it much like the other organizations.
Now, when somebody's an infant, and rightly so, they're attached to the person that's raising them, and they become dependent on them. But that dependency sometimes continues into adulthood, and they become emotionally dependent, and they never learn, some people never learn how to become independent in any way, shape, or form, and that causes problems, right?
Yes, it does. Yes. Well, that's what I was saying. There are many variations on a secure attachment and an insecure attachment, and it's to the degree to which those things happen, like many other things, in healthy proportions. You know, if you're baking a cake, you can have all the right ingredients, but if they don't go in the right proportions, you might get a very different product than you intended.
Yeah, that would be me. I don't do that well putting things together. I mean, maybe a brownie mix, that comes pre-packaged, if I follow the directions. Something that many of us don't do very well.
No, following directions is something that a lot of us have a difficult time with in life.
How long have you been doing this, Alan?
I've been with Menninger Clinic for about 14 years. I've been in this field itself for about 38 years.
Okay, so you've been to symposiums and conventions and different shows where people bring their wares and their booths, and U.S. Journal does it, C4 does it, a lot of folks do it. What do you see as a common thread in today's mental health addiction treatment amongst clinicians? What's a common thread that's going on that is positive?
What I see developing, and it's been something that there have been fits and starts, but developing over a number of years, is that there are actually two major things. One is that things are beginning to be measured and observed in a more scientific, more systematic fashion that I think benefits everyone. Looking at not just what my intent is and what I'm trying to do, but how do I actually go about doing that? There are some things that work and we can measure that, and some things that don't work as well and we can measure that. And the other thing is there's a beginning to be more of an integration of what previously was kind of opposing camps almost. There was a chemical dependency or alcoholism addiction side of the equation, and then there was a psychiatric side of the equation. And still are many things that keep the two from getting together, but more and more we as a provider community are getting together to look at the benefits that each side has to offer.
Even the faith community is starting to get more on board with the psychological, with the addiction side. I mean, because, it's been us against them for so long, because people haven't understood certain terminology, certain languages, when we've really been talking about semantics a lot of the time, right?
A lot of the time it has been semantics, yes. And there's always, I think, a fear of the unknown and a fear that if you acknowledge someone else, the benefit that they bring, that you diminish your own benefit, and it's not like that at all. There's so many people who are, and the need is so great that we all have something to offer, and it advances all of us if we can start to cooperate and cross-fertilize those ideas.
Right. And that's why things like this today are so vitally important, because there was a time 76 years ago or whatever, back when this whole thing kind of got started in the 12-step world, when the medical profession and the 12-steppers were on the same page, and then it just kind of got divided. It's coming back around, though, right?
It is coming back around in a lot of ways. I hope we can continue to do that when forces that are focused on clinically what works take precedent over forces that are economically incentivized.
And that's a big issue. That's like when I talk to treatment providers, I go, what is the biggest obstacle? They say, the financial piece. Because most addicts and alcoholics, for instance, they're not doing real well financially, right?
True, and the money that is out there, it's been taken from the delivery of care in many cases and diverted to other aspects of the management of care and the management of companies that are, they have certain incentives that are moving them away from strict patient care to include other constituencies and their interests.
Right. Well, Alan, thank you for spending some time with us. Thank you for hosting this thing. This is so vitally important. It's been a pleasure meeting you, man.
Pleasure to meet you, Monty, and thank you for doing the work that you do. It's so important that we can destigmatize as much as possible the entire field of recovery and mental health, because it's to everyone's benefit, and my personal belief is that none of us gets out unscathed. So the more we can help each other, the better off we are.
You bet. Alan Altman from Nenninger Clinic will be back in just a minute. Hey, September is National Recovery Month, and the Recovery Northwest Project, September 12th through the 14th. Beginning Friday at 9 a.m. with an incredible 2-day conference at the Red Lion, Vancouver, featuring the movers and shakers of the recovery community. Then on Sunday, we'll move on over to beautiful Esther Park after the recovery walk and to join the powerful Hands Across the Bridge ceremony. Exhibitors, music, speakers, fun, food, and the power in numbers as hundreds of us gather to celebrate National Recovery Month at the Recovery Northwest Project, Vancouver, Washington. Visit recoverynw.org for details on all the events. Supported in part by the Clark County Department of Community Services Alcohol and Drug Program and the Clark County Substance Abuse Advisory Board.
He's a little crazy, but then again, you already knew that.
I got in like 3 fights when I was in grade school. All 3 of them were with the bully. We all know who they are. They're always a little bit bigger, they kind of smelly, and we duke it out. And after he beat the snot out of me, I'd say, "You come back tomorrow and I'll give you more of that."
It's the Bill Post Radio Show. Bill Post Radio Show. Weekdays at noon.
When I first came to Serenity Springs, I never thought I could stay clean and sober. And And then after being through the 12 steps and getting closer to God and just learning how to live, I can't imagine life with drugs and alcohol anymore.
Introducing Serenity Springs Recovery Center, a fully licensed residential drug and alcohol dependence treatment center for men, specializing in helping individuals with substance abuse problems. Addiction is a disease that deteriorates the body, punishes the mind, and destroys the spirit. Addiction needs to be attacked on all three of these fronts.
They work the steps, they work them extremely hard. Finding God is a big part, and that's what they did for me. They gave me a life second to none.
Residents live in a resort-style accommodations and are able to participate in numerous on-site activities.
Golf and working out, playing basketball a lot.
Serenity Springs is a unique facility that is committed to providing exceptional individual care in small group settings.
They talk about life beyond your wildest dreams. I never thought that was possible for me, and today I'm living it.
And just being connected. Guys are like my brothers, just a big family.
At Serenity Springs, they want to make a life-changing investment into your recovery. For more information, contact their 24-hour admissions department at 386-423-4540 or visit their website at serenityspringsrecovery.com.
It's really amazing what's happened. I mean, it's nothing short of a miracle.
When it comes to drug and alcohol treatment, all of us here at Take 12 Radio understand how overwhelming it is to find the right facility for you and your loved one. The internet alone is flooded with drug and alcohol treatment centers claiming to be the one that can help achieve a life of abundance free from addiction. How can one possibly know which one to choose? Well, when you call Broad Highway Recovery for a drug and alcohol treatment referral, you will immediately know that the person who answers the phone is very passionate about making sure they recommend the best facility for the individual that's in need. They will narrow your search down to 3 drug rehab facilities based on the information that you provide. Each call is confidential, and each caller will be treated with the utmost respect and compassion. Look, you don't have to go through this alone. The folks at Broad Highway are interventionists that are 100% committed to helping your family. If you are willing to go to any length for your loved one, then they can help you begin the recovery process. Please call them today and take the first step towards a new and bright future on the broad highway of recovery from alcohol and drug addiction. Their toll-free number is 877-487-1599. That's 877-487-1599. Visit their website at broadhighwayrecovery.com.
Oh, the Oregon weather's dowdy, 'cause the sky is mostly cloudy. You can't stop if you complain, so let it rain, let it rain, let it rain.
All right, we are back, and the last individual, last but not least, that's for sure, that we're talking with today at the behavioral, what would you call this, Larry? What would you call this event?
It's a behavioral health networking event, so that our goal is to get the behavioral health community and addiction community together so that they know what's out there and what resources are available to everyone.
Okay, and so this is Larry Mendoza. Now, he is no stranger to Take 12 Recovery Radio. You may have heard his voice here last week on one of our shows. And Larry is with Awakenings by the Sea. You also you wear a lot of hats in a lot of different areas. What's some of the things you do?
Well, I pretty much wear 2 hats right now. Locally in the Pacific Northwest here in Oregon, I work for Awakenings by the Sea. We're an 18-bed women's program for addiction recovery. And my second hat is I work with Health Communications, Inc., and under that umbrella is U.S. Journal Conferences. Those are conferences for behavioral health and addiction, and we put 9 on per year all over the country. And I'm in charge of helping get some of the speakers for those events and pretty much doing a little bit of everything to make sure it runs well.
Yeah, well, you do a lot of work, man. We appreciate it so much. Okay, so the Behavioral Health Networking Event Luncheon here at the Chart House. We've been sitting here now for a couple of hours. We've heard from a lot of different people. How did you feel it went?
I think it went real well. You know, one of the things that you see a lot out there in the community is you have therapists working with their clients, you have treatment centers working with their clients, but they don't take the time to get to know each other, and that's what this event is all about. We want to be able to, in the treatment side, help our people get better and then refer them to good folks who could continue their recovery after they leave our facility. And the same thing with the private practice therapists that are here. You know, they are looking to meet us, but they don't have time to meet us because they're too busy in their private practice.
Right. And so this is another way, too, for people to be able to say, well, you know, maybe our facility, this isn't going to fit your need, but I know some other people that will. Whereas not too many years ago, we couldn't refer anybody else because we didn't know the other person. And now we're talking and we're getting on the same page, right?
Absolutely, and that's what events like these are meant to be. There's enough help out there for everyone, whether you have the funds to go to treatment or you don't. There's services all over. It's just about getting to know who they are. And one of the nice things about our industry here is that everybody is willing to help each other out. And like you mentioned, if somebody comes to Awakenings and it's not a proper fit, then we're happy to refer them. That would be a great fit for them.
Have you ever had the experience of somebody coming to the facility and they were there for a little while, but it just wasn't a proper fit, and then they were able to go somewhere else?
Absolutely. In a lot of programs that I've worked at in the past, we've had people who, particularly, I guess it's both genders, men and women, but more so women, where they'd come to a co-ed treatment facility, and they'd start there, they'd be there for a few weeks, and it just wasn't a right fit. And it turns out they have issues with men and who may have hurt them in their life, so referring them out to a women-specific program such as Awakenings by the Sea is a tremendous help and resource out there, and that's why we do what we do.
Now, how many beds do you have out there?
We have 18 beds. It's a beautiful old church that was converted into a house. We do full medically managed detoxification, and a woman can come out to our program for as little as 30 days and stay as long as 90 days.
Do you find that the long-term treatment works better?
Absolutely. Statistics have shown that 90 days is really should be the minimum amount of inpatient treatment that folks should receive. 30 days, it's a good start. It's enough time to get you detoxed and get your head clear again, but you haven't really started the work until after 30 days. So 90 days is preferred.
Now, do you guys do like what some of the other centers do? You work with the families too, so the people aren't thrown right back into the same situation they were in when they came into treatment?
Absolutely. We have a weekend family program that the family members, such as parents or significant others, wives, they all come to. We ask them to participate in. They learn about the recovery process because a lot of them aren't aware of what the recovery process is. So we teach them about that, and we teach them about the changes that their loved one is going through. And another special thing we do at Awakenings by the Sea is every lady who comes to our program, they get a special tract on relationship and couples work, which you don't find at a lot of treatment centers. And so that's what I think makes us unique and different.
Well, that's great, my friend. You've been doing this for a while now. You yourself, are you a member of the recovery community yourself?
I am not a member of the recovery community, but I am actually a child of an alcoholic that was in an abusive relationship with my family. And so because of addiction, my family was destroyed. Is that
what helps inspire you to get into this work?
Absolutely. I want kids and adults out there to know that it's not your fault, and when you're a kid, that's kind of what you think, and we want people to know that it's not.
So you had to go through a healing process yourself.
Absolutely. Yeah, there's abandonment issues, also, like I said, some physical harm issues, but no, there's help out there for everyone.
You are one of these guys. I was kind of describing you to a friend of mine the other day. Yes, I did talk about you behind your back. and I was saying, this guy has got such a gentle spirit. You do. You just have this gentle spirit. When people are around you, you're calming. It's a wonderful thing. And yet, it's amazing, those of us who have been victims and been part of an abusive situation and so forth, you would think that we'd be angry and bitter and just on the prowl all the time. What do you attribute, your personality for today? I mean, you're not timid, but you're certainly not angry and bitter either.
I think it's just kudos to all of those who've helped me as a child and as an adult. I think it's working in this industry and being able to learn a lot, especially with my job with the U.S. Journal Conferences, that has allowed me to listen to all the great minds in the behavioral health and recovery community. And it's really shaped me to be a person who is wanting to give more than receive.
Yeah. Well, you do it so well, man, and I'm really proud to know you, and thank you so much for helping to put this event on, my friend.
Well, thank you. It's a pleasure to have you here.
All right, Larry, God bless you, buddy. Larry Mendoza with Awakenings by the Sea, helping to put on this event, the Behavioral Health Networking event here at the Chart House in Portland. Take 12 Radio on location, recovery talk, and positive music. We're going to wrap this thing up here in just a couple of seconds. We're going to let you listen to some recovery music like we love to do from some great recovery recording artists. And then we'll close out this special broadcast of the Take 12 Recovery Radio Show in downtown Portland. Here's Brian Duncan. If you want to be lonely, just be right all the time.
Start it up right here. Here it goes. If you wanna be lonely, just be right all the time. Take your own advice only, and then just stand in this line. Let me tell you something. It don't start no argument. You know I know I'm right. And things I think you should have learned by now. That's advice. You don't make that face at me, cause you don't want that fight. Cause once you know, it's easy to know how. Just when you get a clue and think that you're no fool, life has this funny way taking you to school. If you wanna be lonely, if you wanna be lonely, oh yeah, just be right all the time. Sing it with me one time, good. Take your own advice only, and then just stand in this line. Come on, yeah. I try to compensate, but I've learned a thing or two, and it's harder now just putting up with you. Oh yeah. Just when you get a clue and think that you're no fool, life has this funny way of taking you to school. If you wanna be lonely, if you wanna be lonely, just be right all the time. Just be right all the time. Simple as that, baby. Take your own advice. Take your own advice only. Yeah. And then you stand in this line. All the time. If you wanna be lonely, just be right all the time. One more thing. Just when you get a clue and think that you're no fool, life has this funny way of taking your heart to school. If you wanna be lonely, if you wanna be lonely, yeah, just be right all the time. Just be right all the time. I know I'm right. Take your own advice only. Take your own advice only. Oh, then just stand in this line. Then just stand in this line. Stand in this line. Yeah. Be lonely. Hey, yeah, if you wanna be lonely. You wanna be lonely. If you wanna be lonely, you wanna be lonely. If you wanna be lonely, if you wanna be lonely.
Well, I always enjoy some great recovery-focused music. That was great. I love the humor. I love the seriousness. Really good stuff. Hey, listen, you can listen to more great recovery music right here at Take12Radio.com on your internet dial. You can go to TuneIn Radio, download that app, and then type in Bill Post, and we're on there from 11 to noon, Monday through Friday, on the live feed on TuneIn Radio under Bill Post. You can also get us on our live streaming feed at BillPost.com, 11 to noon, Monday through Friday. And then all of our podcasts, broadcasts, and archives right here at Take12Radio.com on your internet dial. Once again, recovery talk and positive music. Until next time, this is the Monty Man at the Behavioral Health Networking event and Luncheon on location at the Chart House Restaurant in Portland, Oregon. I am wishing God's perfect serenity for you. Bye-bye now.
This has been a broadcast of KHLT Recovery Broadcasting.
Here, kitty, 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 kitty. Meow.